Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is the Minister of Education, Adriana LaGrange, and Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Minister LaGrange will provide her update, and then Dr. Hinshaw will provide an update on COVID-19, and then we will open the floor to questions.
Thank you. Good afternoon, everyone. I am pleased to be here to share the re-entry plan for the upcoming school year. Our guiding principle is to always put safety first for our students and for our staff. I'm pleased to say we have a pragmatic plan that lays out the different scenarios our schools may face come September. It details 3 possibilities for student learning, which will be based on the pandemic situation. In the first scenario, which is the scenario we are targeting, near normal operations will resume and students will return to daily in-school classes with some health measures. In the second scenario, in-school classes will only resume partially because of additional health requirements. And in the third scenario, at-home learning will continue. Our goal is to get us back to normal learning as soon as possible. Teachers, school boards, and parents did their absolute best to adapt to a different way of learning as they guided and supported students at home since March. And our students did their best to adapt to that learning from home. We all know, though, that students learn best in the classroom with their teachers and their peers, provided that it's safe to do so. I know parents are keen to see what school may look like in the next year and if students will walk into their classrooms on the first day of school. Based on the information we have at hand right now, we expect that students will be at school in September. Our government will make the final decision on the scenario schools will follow at the beginning of the school year by August 1st. But as I've already stated, we are targeting a return to near normal operations with health measures in place. But that said, all school boards will need to be ready to transition from one scenario to the other on short notice to adapt to any changes in the COVID-19 situation. How we return to in-class learning may vary regionally and will depend on the number of COVID-19 cases in total in that area. The reality is that the COVID-19 environment requires all of us to be flexible and nimble throughout the next school year. Everyone has a role to play to support the safe return of in-school classes and reduce the risk for transmission of COVID-19. I do want to stress that the decision for which scenario schools must follow will be decided by the government based on public health guidance, not by local school authorities. School authorities will not be able to pick and choose which scenario they are operating in. This process is to ensure that all our schools are adhering to the appropriate health measures for their region. However, school authorities will have the autonomy to determine how they meet the public health guidelines issued under each scenario, and they will be responsible for developing their own academic calendars. To ensure the public knows how our schools will operate under each scenario, we have released health guidelines as part of the re-entry plan. I encourage families to go through them and for parents to talk to their children about what school may look like after summer break. As you know, Dr. Hinshaw is here, and she will provide specific details of the health measures. I will just give you a quick overview of what you can expect in the upcoming school year. The health precautions include frequent hand washing and sanitizing before and after entering school and classes, and increased cleaning of surfaces at schools and on buses. Parents will have to keep students home when sick, and family members who have symptoms must not enter the school. In Scenario 1, which is near normal operations, students and staff should, when possible, practice some physical distancing as a good precaution to prevent the spread of the disease. But in classrooms, buses, and during activities when physical distance may not be possible, then extra emphasis will be put on other hygiene practices. If school authorities were to transition to scenario 2 at any point, stricter health measures will be in place. This would include physical distancing of 2 meters and a recommended maximum of 15 people in a classroom. In that case, students will attend schools on a modified schedule, and it will be up to the local school authority to create their class calendars. We have tried to strike a balance in the reentry plan to provide standardized approaches in some areas while also providing flexibility for schools to do what works best in their communities. The comprehensive reentry plan provides clarity on areas such as student learning and transportation, specialized supports for students with special needs, mental health supports, extracurricular activities, and provincial exams. We worked closely every step of the way with teachers, with school boards, and with parents. I'd like to thank all of our education partners for sharing their feedback and helping us shape this plan that takes into consideration the complexity of school operations. I am grateful for everyone's contributions. And thank you as well to the more than 66,000 parents who shared their input on the survey by the Alberta School Councils Association. Our government made decisions and is sharing the reentry plan in a timely manner to allow school authorities to continue planning for the upcoming school year. I hope parents and students can take comfort in the extremely likely possibility of a return to their local school in September. While things will not be exactly as they were before the pandemic, students will be back learning in an environment they know. Thank you, and I will now turn it over to Dr. Hinshaw.
Thank you, Minister, and good afternoon. Before I begin, I want to note that yesterday, Alberta Health incorrectly listed Care West Garrison Green as an outbreak. It is not an active outbreak. There have been 2 cases at the facility, both of which have long since been recovered. We are working on our outbreak reporting processes to ensure that the outbreak information is timely and accurate. I am pleased to report that today, 6,754 Albertans have recovered from COVID-19, leaving 371 active cases in the province. Currently, 42 people are hospitalized with COVID-19, with 6 of these in ICUs. Proactive testing is a cornerstone of Alberta's relaunch strategy as we move safely into Stage 2 this Friday. We have now completed more than 310,000 tests. Out of 6,582 tests completed in the last 24 hours, there were 47 new cases. Thank you to everyone for getting tested, even if you did not have symptoms. In the last 24 hours, there have been no deaths in the province. The total number of lives lost remains at 151. We must always remember that COVID-19 can be fatal and that many families have been devastated by this virus. I must also report that there has been a small outbreak in a unit at the Alberta Hospital in Edmonton. 4 staff members have tested positive to date. No patients have tested positive. AHS has taken swift action to implement outbreak protocols and ensure that all staff and patients are being tested. Testing lets us take action quickly to make sure that all are kept safe. As we move towards Stage 2, I know that many Albertans are looking forward to more activities. I know there are students who want to take their diploma exams, and schools and school boards eager to make that happen. I know many are excited that we are now able to safely reopen recreation centres, libraries, and theatres, participate in arts and sports activities, and attend some cultural events. I also know that many other Albertans are feeling anxious about this reopening. It is important to remember that both responses are natural and valid. We are in a time of balance where we need to balance the needs of some Albertans for the reopening and the needs of others for safety, and we need to hold those together in tension. This virus is still with us, and I remind all Albertans we are the best protection for ourselves, our friends, and our neighbours. Indoor gatherings can now include as many as 50 people while staying 2 meters apart. For outdoor gatherings or seated audience events, indoors or outdoors, the maximum is now 100 with appropriate physical distancing. We have posted guidelines, but it is on all of us to apply them to whatever gathering we are organizing or attending. The same goes for other activities, such as worship services, that no longer have a cap beyond the number that can be accommodated while ensuring that physical distancing of 2 meters is in place between households or cohort families. I urge all organizers to apply the available guidance as best you can and in every possible way. Stage 2 is an important shift for our province, and I know that many questions exist. We posted guidance documents and will continue to expand this information in the coming days. I want to emphasize that no businesses or services are required to open this Friday. Reopening should happen only when they are ready. We are all responsible for our health and for moving at our own speed. I have had many questions about cohorts or small groups of people that don't have to consistently stay 2 meters apart. As I mentioned yesterday, you can expand your cohort group to friends and other households to a maximum of 15 people. We will be sharing additional guidance in the coming days. As you just heard from Minister LaGrange, we are hopeful students can return to learning in school in September in a way that's close to normal operations. Important hygiene measures will be in place: cleaning and disinfecting, routine screening for illness, a stay-at-home policy for staff and students who are ill, and physical distancing wherever possible. Students may be grouped in cohorts, and rooms could be reorganized to create more space. Masks would not be required, though they could be used if a student is ill or in cases where physical distancing is not possible. There are a lot of details here, and I encourage everyone to read the re-entry plan. I know there will be many questions. I am happy to answer them today and in the coming days. I do want to emphasize that we will continue to monitor the situation in Alberta closely. As Minister LaGrange noted, the government will make the final decision on which scenario to follow by August 1st. I'm hopeful, as I know many of you are, that we can safely return to in-person operations with health measures in place. A safe and successful school year can be possible if we all work together over the summer and into the fall to keep transmission low. For us to maintain this low level of transmission, we must all do our part. This is especially true as more of us are leaving our homes and starting to see others. Please, if you get sick, stay home and arrange for testing. Keep your physical distance when around people who are not in your cohort. Wear a mask when that's not possible, and wash your hands regularly. You can also use our relaunch map to see where active case rates are at in the province in different municipalities. Today, we have one local municipal district that has moved into the watch category with 10 active cases. We are in discussions with local officials about the cases and whether any further measures might be necessary. With testing at such high levels as we currently have, it is not surprising to see areas with small populations go in and out of watch level, as only 10 cases are needed in these small areas to trigger this level. I want to remind Albertans that this watch level simply means that we in the ministry work with local public health and local officials to determine if any additional measures might be required. It does not automatically mean that additional public health measures are put in place. I want to encourage people to participate in our asymptomatic testing, especially if you are part of a cohort group. As I mentioned earlier, testing is an important way for us to monitor the spread of the virus. I also encourage everyone to download our voluntary contact tracing app, AB Trace Together. Coupled with testing, this app will help us prevent the spread of COVID-19 as more of us spend time in our communities. I want to end today by saying how grateful I am to everyone for following the public health guidelines. Together, we continue to slow the spread and protect our friends and loved ones. Every Albertan should be very proud. We are weathering this storm and protecting each other. Let's continue to take pride in that protection of each other as we move forward to enjoy our activities, but with caution and care for those around us. Thank you, and we will be happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, this question's for Dr. Hinshaw. I have a couple of clarification questions first. When were the cases at Alberta Hospital detected? How many cases are there now at Sofina Foods? And then my question is, some in the wedding industry and those getting married are a bit upset because the guidance for gatherings has evolved from maybe your wedding should be postponed until later this year to 15 people can gather to now 100 if the wedding is outdoors and seated. What do you have to say to vendors and couples who are feeling a bit frustrated?
Sure. So clarification, Sofina Foods, there are currently 6 cases at Sofina Foods. With respect to the outbreak at Alberta Hospital, this was an outbreak that was identified yesterday, late in the day, and so currently, again, there are 4 cases, all in staff members. No patient cases have been identified. With respect to the concern about those who are either planning their own weddings or those in the industry who support those who are getting married, try to plan, especially something as important as a life event as a wedding is. And so I know people often plan for years in advance for the wedding that they want to highlight their own experience of making that commitment to another person. And so I again offer my sympathies. I know that with this changing environment, it has been frustrating and difficult. What I can say is that we are doing our best to adjust our planning, our guidelines, and our limits to the current public health risk based on the number of cases. And so earlier this year, when we were looking at the spread that we were seeing in other parts of the world, we were looking at our own numbers and different scenarios. It was difficult to know exactly how the pandemic and that first wave would evolve. And so we did the best we could to make decisions based on our active cases and our trajectory. We know that with respect to the projections that we put forward, the different modeling that we had with respect to hospitalizations and ICUs, that we would have been almost exactly at those model numbers for hospitalizations had we, for example, followed the Quebec experience. And so thanks to Albertans, we didn't follow that experience, and we can open up sooner and have these larger gatherings. But it really, again, depended on our collective ability to make this happen. And so there are no guarantees. And I would also say that as people are moving forward to plan events, they need to think about the possibility that we could be seeing a second wave at some point if we collectively don't take care to prevent the spread. So unfortunately, we can't guarantee what will happen with the pandemic, and we are just doing our best to adjust our guidance based on the most current levels of risk. And for some people, absolutely understand that's incredibly frustrating, and I'm sorry for that. But what we need to do is make sure that we're protecting our population from large spreading events, and we know that weddings and social gatherings can offer opportunities for large spreading events.
Operator, can you put through the next question, please?
Next is Rafi Boudjikanian with CBC. Go ahead, Rafi.
Hi, thanks for coming to me. I guess I have a first question for Dr. Hinshaw, which would be, given that you're envisioning or hoping for scenario 1 in September, what will you be looking at in terms of factors that would make you switch to a scenario 2 or 3? And a follow-up for Minister LaGrange, could you tell me, I understand you want, to have a certain kind of, regional difference in terms of what going back to school will look like. Given that, could you tell me why the government will make the final decision and not allow school boards to choose between the different scenarios? Thanks.
So with respect to the first question, we'll be watching the number of active cases, we'll be watching our hospitalizations, our ICU admissions, looking to see where the spread happens. But in addition to that, we'll be watching very closely other places around the world that have opened schools. We'll be watching to see the evidence that emerges about what practices make school reopening the safest possible and how we can learn from experiences of others. And so we'll be incorporating both that emerging evidence around reducing transmission in schools, as well as looking at our own experience with the cases that we have in the province. And those are the things that would be informing whether or not we would need to take a different approach other than an in-school return, which is, again, what we hope can happen based on what we're seeing in other jurisdictions. And hopefully our case rates, again, we can collectively make sure that they stay low.
Thank you. And as to your second question, looking at it from a regional perspective will only happen if, in fact, we hear from Dr. Hinshaw and Alberta Health that we need to take a different approach with a different area because of perhaps an outbreak. So there may be a different warning level in a particular area. So again, we want to ensure that every school division is working with Alberta Health and with the government. And we needed to take an active approach in ensuring that the government sets the scenarios, and then within those scenarios, those individual school authorities can decide how those scenarios are enacted within their local context.
Operator, can you put through the next question, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. We're hearing from a growing number of people concerned that Albertans are becoming complacent over social distancing and wearing masks. Are you concerned that that is happening, and what would you say to people who think that we no longer need to wear masks or social distance? Also, out of curiosity, there's a New York Times article talking about excess mortality. Any chance we have the number of where Alberta's excess mortality has been during the COVID pandemic?
So with respect to the question about complacency, I think that one of the things I've said previously in availabilities is that unfortunately we can sometimes be a victim of our own success, where we've been able to keep our case rates low through our collective efforts. Sometimes people see the low numbers and think that that means that we don't have to take those measures. So I would remind Albertans that this is something that we do need to continue to protect each other against for many months to come. And I think that one of the things that is important is to remember why we're doing this. I think if people only think about the restrictions and what they can't do, it starts to become more frustrating. Whereas if they think about who in their lives is over the age of 70, who in their lives is someone who has a chronic condition, who might be at higher risk of illness, and think about how you would want others to protect those people that you love, and therefore how you can behave to protect the loved ones of others. So that would be what I would encourage Albertans to think about when they're really feeling like maybe they don't need to social distance, maybe they don't need to wear a mask. Think about, who are you protecting? Who are you protecting in your own life, in your own family, in your own circle of care? And who are you protecting for others? Because when we remember why we're doing something, it becomes much more important to us to actually keep all of these measures in place. With respect to the excess mortality, there has been some early data released from the National Vital Statistics, so we can follow up with that later on. What I would say is that the early data is not complete, so we don't yet have a really firm understanding of what the excess mortality is, but we do have some early estimates, so we can follow up with that later on.
Operator, can you put through the next question, please?
Next is Janet French with CBC. Go ahead, Janet.
Hi there. Thanks for taking my question. Just a question for Minister LaGrange. So, you talked today in question period and have referred to before the global amounts of education funding rising in Alberta, and also pointing to the dollar amounts going up in all school divisions this year as compared to last year. But you know that it's not even across the table due to the way that enrollment is counted with a 3-year weighted moving average. So I guess I'm just curious what you would say to parents and families with children in Edmonton public schools. That board feels like they are being particularly penalized by the new education funding formula. And so what do you say to families who are going to have their kids in larger classes next year while there are concerns about a pandemic and potentially, kids losing access to educational assistants and other professionals?
Well, Janet, thank you for the question. What I can say is what I reiterated in the House today is that every single school division will be receiving more dollars in their operational funding, and in particular, Edmonton Public will be receiving approximately, if I remember correctly, about $14 million more in their over $1 billion budget. When I look at when we were developing the model, we included every school division across this province. We had extensive consultations, and we knew that we were looking at maintaining a $8.223 billion budget, which I have to say is one of the best funding budgets for education across this country. And we had the input of all school divisions and the wide support of the majority of school divisions.
Operator, can you put through the next question, please?
Next is Lisa Johnson with Post Media. Go ahead, Lisa.
Hi, thanks for taking my question. I'm wondering, just looking back to March when schools were closed, Dr. Hinshaw said that part of the reason was she was hearing from educators that it was difficult to carry out her advice in part because of limited staffing and supplies. So I'm wondering if the province does go forward with the ideal scenario of going back to classes in the fall, what's the plan or what has changed in terms of staffing and supplies? Will there be an injection of support, of financial support for outfitting things like hand sanitizers and stuff like that?
I think this one's for me. Thank you for the question. When we started on the reentry plan, we started consulting with all of our education partners quite extensively. So we are continuing to work with school boards, with parents, and with the ATA, and all other groups that are involved to determine what is actually going to be needed and how we're going to provide those resources. Again, school divisions have within their budgets the ability to allocate funds and resources to address these needs, but we will certainly be working with them as we move forward on the reentry plan. We're just very thankful that and hopeful that we will be able to go back to scenario one, which is in-school classes with near normal operations. That is what we heard from parents from the Alberta School Board or School Councils Association when they did their survey. The vast majority of parents want that scenario. We're hopeful that that will be the case come September 1st, or when that particular calendar happens for individual schools.
Operator, can you put through the next question, please?
Kevin Nimick with CTV. Go ahead, Kevin.
Hi there. I have a question for both the minister and the doctor. We'll start with the minister. Several school boards have sent out surveys to parents which aren't due until the end of this week to get their opinions on how they would like to see schools reopen. So why are you presenting a plan to the public without the views of some of the people you're representing? And for Dr. Hinshaw, how can you be sure students are going to stay 2 meters apart? And is it a fair expectation to put on teachers to be able to maintain social distancing rules when we know that they're already dealing with so many other challenges in the classroom?
So to your first question, the reentry plan, as I said, we've consulted broadly. We've had the input of all the major stakeholders across the education field. We've had the surveys from parents, etc. But we know that individual school boards will be looking to develop their individual plans as to how they will operate under their scenarios. And so the consultations that they are doing will inform those decisions. As well, we are constantly looking for feedback, and if there are individual school boards or individuals that have ideas on how we can enhance the reentry plan we feel we have a very solid, strong reentry plan, but we're always looking for input and value that input as it comes. Thank you.
So with respect to the second question about the ability to keep students cohorted or keep students distanced, one of the things that we were looking at as we were developing the public health part of the school reentry plan was again looking at balance. And this is a common theme of relaunch, is that we know that there are consequences to having children not able to be in school. We know that there are risks to those children. We know that there are some consequences for broader society to having a universal distance-delivered education model. And so we need to balance the risks of continuing that distance model or the risks of bringing students back to school, because there is no one risk-free option that we have at our disposal, unfortunately. So we're seeking that balance. And what we're saying with respect to distancing is that in some of the younger grades where it may be more challenging to have students distanced at all times, we do have some recommendations about how desks could potentially be arranged to limit the possibility of transmission while students are seated in desks, how they could potentially be how the activities could be structured when they're not at desks, and then using more of a cohort model again. So when children go back to school, especially children in the younger grades, if they can be kept within the same cohort of children, if there is an exposure, it limits the total number of people who could be exposed and limits the ability of that to spread beyond. So we're using multiple layers of protection. Distancing is one element, cohorting is another, making sure that there's regular screening so children do not come to school when they're feeling ill, when staff or teachers also have that regular screening that they're not coming to school when ill. So there's no one single intervention that's going to prevent spread. We have to layer all of them on top of each other and again balance the risks of coming back to school in person with the risks of students staying home. Because again, there's no one perfect option, and we have to find our best way through this, balancing all of those risks.
All right, I see there's only one more in the queue, so operator, could you put through the final question, please?
Yeah, final question is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hello, this is a question for Dr. Hinshaw. Dr. Hinshaw, I'm wondering why Alberta isn't collecting race-based data during the COVID-19 pandemic, and what evidence exists, if any, that the virus is more greatly impacting racialized communities in the province?
So we have had, as a part of our data collection from the beginning, we have had a field for collection of self-identified ethnicity data. That field, sometimes people choose to not provide that information. And at the beginning, where we had very significant volumes, it wasn't always possible to get the details around that data, as we were focused on some of the key pieces around having the contacts traced and really moving quite quickly through the contact tracing process. We have been working on more robust data collection around ethnicity, and we are working to see how we can make that information available to the public. So that is in the works. And so we will have hopefully some information to share in the coming weeks, but that work is still underway. I do anticipate, as we've seen in other places, that when racialized communities experience other issues such as the disproportionate levels of socioeconomic status that sometimes can be true for racialized communities, again, it's often about the social circumstances that tend to come together for individuals who experience racism, and not so much about an individual in terms of the biology of how they respond to a virus. It's more about social circumstance. So we are looking not just at ethnicity, but also at what socioeconomic status data we have available to be able to be a part of that report. So again, we anticipate to be able to make something available in the coming weeks, but we don't have that analysis finished at this time.
Thank you all for joining us today. Dr. Hinshaw will provide another update on Friday afternoon.